Discovering a lump or bump in the vaginal area can be an alarming and sometimes confusing experience. Yet, it is a common concern, and in most cases, these changes are benign and manageable. Understanding the causes, how to identify different types of lumps or bumps, and knowing when to seek medical attention are essential steps in maintaining your reproductive health and peace of mind. The female genital area is complex, with a variety of glands, hair follicles, and tissues, all of which can be affected by different conditions. It's important to remember that the term vagina is often used to describe the entire genital area, but medically, the vagina refers specifically to the internal canal. The external area, including the labia, clitoris, and the opening to the vagina, is called the vulva. Lumps or bumps can occur anywhere in this region, and their underlying causes can range from completely harmless to requiring medical intervention. Let's begin by exploring some of the most common and benign reasons for developing lumps or bumps in the vaginal or vulvar area. One of the most frequent causes is an ingrown hair. The vulva is covered with hair follicles, and shaving, waxing, or other forms of hair removal can sometimes lead to hairs curling back into the skin. This can result in small, tender, sometimes red bumps. These are generally harmless and often resolve on their own, though applying a warm compress can help soothe discomfort. Another typical cause is the formation of sebaceous cysts. These are small fluid-filled sacs that develop when a hair follicle or oil gland becomes blocked. Sebaceous cysts are usually painless, round, and smooth to the touch. They may remain the same size for a long period or slowly grow, but unless they become infected, marked by redness, swelling, or pus, they rarely require treatment. Bartholin's cysts are another potential finding. The Bartholin's glands are located on each side of the vaginal opening and secrete fluid that helps lubricate the vagina. If the duct of one of these glands becomes blocked, a fluid-filled cyst may develop. Most Bartholin's cysts are painless and go unnoticed, but if the cyst becomes infected, it can form an abscess, causing significant pain, swelling, and sometimes fever. While small, painless cysts can be managed at home with warm compresses, larger or painful cysts should be evaluated by a healthcare provider. Fordyce spots are another benign condition. These are small, yellowish or white bumps that appear on the labia or even inside the vaginal opening. Fordyce spots are actually visible sebaceous glands and are considered a normal anatomical variation. They do not require treatment and are not contagious. Skin tags can also appear in the genital area. These soft, fleshy growths are harmless and usually develop in areas of friction. While they don't pose any health risks, some people may choose to have them removed for comfort or cosmetic reasons. Sometimes, lumps or bumps are a result of infections. Genital warts caused by certain strains of the human papillomavirus, HPV, are small, flesh-colored or gray growths that may cluster together, resembling a cauliflower. Genital warts are contagious and can be spread through sexual contact. While they are generally not painful, they can be emotionally distressing. There are various treatment options to remove warts, but the underlying HPV infection may persist in the body. Another sexually transmitted infection that can cause lumps or sores is herpes simplex virus, HSV. Genital herpes often begins as small, fluid-filled blisters that eventually burst and form painful ulcers. The first outbreak is typically the most severe, accompanied by flu-like symptoms. Recurrences are usually milder. Antiviral medications can help manage symptoms and reduce the risk of transmission. Molluscum contagiosum is a viral infection that leads to the formation of small, firm, dome-shaped bumps with a central dimple. These are generally painless and may resolve on their own over time, but they are contagious too and can be spread through skin-to-skin contact, including sexual activity. Some bacterial infections can also cause lumps or abscesses. For example, a bacterial infection of a hair follicle, known as folliculitis, can result in a red, tender bump. More severe infections can result in abscesses, collections of pus that cause swelling, pain, and redness. Abscesses often require medical treatment, sometimes including drainage and antibiotics. Certain non-infectious conditions can also present as lumps or bumps in the vaginal area. For instance, lichen sclerosus is a chronic skin condition that can cause white patches, thinning of the skin, and sometimes small lumps or areas of thickened tissue. This condition requires medical evaluation, as it can increase the risk of certain types of cancer. In rare cases, a lump in the vaginal or vulvar area may be a sign of cancer. Vulvar or vaginal cancers are uncommon, but can present as a persistent lump, ulcer, or area of thickened skin that does not go away. Other warning signs include bleeding, pain, or itching that does not resolve with usual treatments. Any persistent or unusual lump should be evaluated by a healthcare provider to rule out serious conditions. So, how can you identify what you're dealing with? First, pay attention to the characteristics of the lump or bump. Is it soft or hard? Painful or painless? Is there any redness, swelling, or discharge? Did it appear suddenly or gradually over time? Is it associated with other symptoms such as itching, burning, fever, or pain during urination or intercourse? Also, consider your recent activities, such as shaving, waxing, new sexual partners, or exposure to potential irritants like soaps or detergents. While self-examination is helpful, it's important not to panic if you notice something unusual. Many lumps and bumps are harmless and will resolve on their own. However, certain signs should prompt you to seek medical attention. These include rapid growth, persistent pain, bleeding, ulceration, associated systemic symptoms like fever, or any lump that does not resolve after a few weeks. Diagnosis typically involves a physical examination by a healthcare provider, who may ask about your medical history, symptoms, and recent exposures. In some cases, further testing may be needed, such as swabs for infections, ultrasound imaging to assess cysts, or biopsy of a suspicious lesion to rule out cancer. Treatment depends on the underlying cause. For benign conditions like ingrown hairs, warm compresses, and proper hygiene are usually sufficient. Sebaceous cysts that are not infected may not require any intervention, while infected cysts or abscesses may need drainage and antibiotics. Bartholin's cysts can sometimes be managed at home, but larger or painful ones may require a minor surgical procedure to drain the fluid. For infectious causes, treatment varies based on the specific pathogen. Genital warts can be treated with topical medications, cryotherapy, freezing, or surgical removal. Herpes is managed with antiviral medications, while molluscum contagiosum may resolve spontaneously or be treated with topical therapies. Bacterial infections like abscesses or folliculitis may require antibiotics. If a lump is due to a skin condition like lichen sclerosus, your provider may prescribe topical steroids or other medications to manage symptoms and prevent complications. In the rare instance that a lump is cancerous, treatment typically involves surgery, sometimes combined with radiation or chemotherapy, depending on the type and stage of cancer. Prevention is an important part of managing your vaginal and vulvar health. Practicing good hygiene, avoiding harsh soaps or irritants, wearing breathable cotton underwear, and practicing safe sex can all help reduce your risk of developing lumps or bumps. If you shave or wax, ensure you use clean tools and techniques to minimize the risk of ingrown hairs and infections. Regular self-examinations and routine gynecological checkups are crucial. Being familiar with your own anatomy helps you notice changes early and seek advice when needed. Remember, no question or concern is too small when it comes to your health. Open communication with your healthcare provider will help you address issues promptly and confidently. In summary, while discovering a lump or bump in the vaginal area can be concerning, most are benign and easily managed. By understanding the potential causes, recognizing warning signs, and knowing when to seek medical attention, you can take charge of your health and well-being. Always trust your instincts, stay informed, and don't hesitate to reach out to a healthcare professional for guidance or reassurance.